These are the cardiovascular risk markers that you want to have run on the yearly basis to make sure you're not developing heart disease. So there's your lipid panel, but you should always run it with your lipoprotein subfractions as well, so that we know what particle sizes are part of your lipid panel. It's important to know. Then you have lipoprotein A, which is LP little a. That gives us like more of the genetic tendencies toward having heart disease. Then you have apolipoprotein B, which tells us, do you have active atherosclerosis actually forming in your bloodstream right now in your blood vessels? We want to know about that number. Oxidized LDL is a great number to run to tell us not just if you have LDL, which is the bad cholesterol, but is it oxidized? Is it more dangerous because you have inflammation or high blood sugar? That's important to know. High sensitivity CRP and ESR are both inflammation markers. So those are really important for you to know how much inflammation you have. Then you have LPPLA2 activity, which is also an inflammatory number that relates to heart disease. So we want to know what that number looks like. Fibrinogen tells us if you're clotting and how high and how much you tend to clot. Homocysteine is something that can be in your bloodstream that can be very scratchy to your blood vessels, and you use B12 and folate to process it and break it down into glutathione. Are you doing that, or are you stuck at homocysteine? That's important to know. Then you've got hemoglobin A1C and insulin. So those guys are just blood sugar, right? If your blood sugar gets high, your insulin gets high, your inflammation gets high, you can develop heart disease. That's a fact. So let's know what your blood sugar is. And then there's TMAO is the last one. TMAO is really interesting. So if you eat red meat and you eat eggs and you process them well, amazing. But if you don't process them well, you can increase your TMAO and it can cause heart disease. For some people in the population, you can actually eat red meat and eggs and develop heart disease, but not everybody. So you want to know how well you process those things and if you're going to develop high TMAO and if that's a heart attack risk factor for you. So this is the markers that I would run. If you need some help interpreting them, please send them my way or reach out, DM me. I'm happy to help.